So I wanted to show another case study on here, which is a really interesting one. I'll jump through, and again, it's real people. Talk about this one. It's acne. Acne is a big problem. I think it's about 85% of people, young people, will suffer from this at some point. And it's a nasty disease, quite frankly. Now here we've used before and after because that's what Gemma wanted to do, and I said I think that's actually I think with this situation, I think a picture does say 1,000 words. These pictures were taken 1 month apart, and you can see a significant improvement. So let's go into and have a quick look. Acne, the background to this disease, essentially, it's a condition. It's on the rise in all Western countries. It's particularly nasty because it tends to really kick off and present itself just around and after the age of puberty. So these are times when young people are starting to form relationships, they're starting to form social circles, and they're starting to be under times of stress, so formal educational exams, these sorts of things. So not only is it physically quite distressing, but also emotionally as well. So it really hits people on all levels, and it can lead on to things such as anxiety, depression, all sorts of other things as well, which are really not nice at all at the time of your life when really you just want to be having fun and going out and getting on with stuff, and don't really want to be caring about other things. And you know, I think it may be the case more so for girls and boys, although I don't want to speculate on that, but certainly in terms of for somebody's appearance, it's not a great thing to happen. And the thing with acne is that told that these things can't be cured. It's just maybe it's just some people get it, some people don't. It's just genetic and all these things. But I think really with this, there's a lot of research required, and the approach to it needs to be quite specialist. Gemma came across the work that I'd done from the talk I did at the Whole Foods market in London, and saw that I'd mentioned a few bits on acne, and I talked about anyway, so she'd approached me and said, yeah, okay, so this is a situation I've been in, and gave me the story. And her background is very typical, very typical, and I mention that word for word here because appearance is important. She ended up being bullied at school, which is common from people who suffer from acne, and that can really exaggerate this condition as well by aggravating it with increased levels of hormones such as cortisols and things like this. It's just stress hormones. So anyway, Gemma had done the typical thing that most young people will do. They'll try the sorts of things you can buy over the counter. They'll try things they might read on the internet. So it might be creams and lotions, maybe some of these sort of aromatherapy or these sort of homeopathic remedies, these types of things. Some of these things may have an effect, and I wouldn't like to say that they don't. But I think if we're going to get rid of this, and this is a tough disease, it does require a tough approach. Gemma had been referred by her GP to a consultant dermatologist for help with the acne, and was given a course of a drug commonly known as Accutane, the trade name, but it's Isotretinoin, which is a very powerful steroid, and it dries out the skin very quickly, and sometimes to the point that people they just can't be out in sunlight because their skin gets so dry. It does work to some extent, but the side effects are absolutely brutal, particularly for girls, because there's a huge association with birth defects, and from the whole point of some of the mental health standpoint, you don't want somebody in their late teens, early 20s to be on these types of medications, because they really do affect people's mood massively, and that's awful. And Gemma mentioned this. She said, my teen years were ruled by acne. It affected me on every level, and I hated it. And we went to a dermatologist, so they prescribed a course of this medication, and it did something. And I said, I was listening to what Gemma was saying, and she said, well, it was causing all these sorts of things. We're talking about horrible nightmares, weird emotions, these sorts of things. So she went back to a dermatologist. They took her off the medication because that's what the guidelines will say. If somebody's having these sorts of emotions, well, we'd rather keep them alive than carry on, even if it clears up. But the thing is, the acne, which had disappeared through the kind of treatment, came back. And that really is very disappointing, and I think that can cause people to get into a much worse state than they may have been to start with, because what we're talking about there is dependency, and that's not good. So really what happened then going forwards is Gemma then a year later, quality of life became so bad, back through mental health services, through GP referral, dermatology, given a lower dose of the same medication, got results, same side effects. But because, quite frankly, the way it affected her lifestyle, it was so shit what it had done. She completed the course, and it cleared up the acne. But after a month later, the acne was back. So really what it was Gemma had come across my work, and she said, well, is there something we can do? And I said, there is research that shows, yes, we can do something about it. But it's going to require you to do something significant. And she said, well, at this point, yes, I'll give it a go. And she said, well, I can't find anywhere of this, and this is something I'll show here. This is something here. This is on the NHS website, actually, that's your full URL here. So we're looking at acne causes. And it says acne is caused by a poor diet is a myth. So really what they're showing here is this is the guidelines. They're saying, well, it's not caused by diet at all. Now, this is the point where I said, okay, I've got a bit of a divergence of opinion here. I don't think that's necessarily the case. And you look at these sorts of things, the treatment of acne, well, here's the things that people say you can try, and this is the things that Gemma would have tried, and so don't wash these things more than twice a day and all this sort of things. Some of these things might be sensible, some of these things are ridiculous, to be honest. It really doesn't make any sense. And then you can get treatments from your GP. Now notice along here, nothing here says anything about treating this with diet whatsoever. Nothing says anything about it. Nothing. All the way through, all sorts of different things that we're talking about here, all these things, and there it is again, it trots up again, this isotretinoin, very, very potent. And so we thought, well, let's have a little, can you help us improve? Yeah, I could, but I think it might be rejected. So anyway, so I looked at this, and somebody who I studied, and then one of the qualifications that I hold is under John McDougall's work. He may have come across, and he said, well, this is on his website, he's saying, well, to learn if diet is a primary factor in acne cases, we would have to demonstrate the absence of a disease in populations of people whose diet differs considerably from that of Americans. Americans can be replaced with people in the Western world. And so there's not massive amounts of data available, but when we went into a bit more research on this, and this is through Michael Greger's website, the nutritionfacts.org, and he's a clinical nutritionist and graduate of medicine and a graduate of Cornell University as well. He's shown that this enzyme, this TORC enzyme, actually is promoted by certain foods and tends to do these things down the line. You tend to get early onset acne, persistent acne, obesity, type 2 diabetes, cancer. It doesn't really get particularly great as you go down the line. So we thought, well, okay, well, what foods are going to promote this and what foods are going to reduce levels of this enzyme? So that's what we did, and we went through it. I went through a lot of detail with this. I went through a consultation with Gemma over the phone, and I prescribed quite a strict diet, but I assured her, I said, I've got the evidence here, so let's have a look at it. And she, at this point, she said, okay, look, I need to do something. I can't have that medication again because I can't go through the side effects, but also the guidelines say I can't have any more courses of it. So she went for it, and Gemma had suffered enough, really, and it is a tough disease, and so we had to approach it in quite a tough way. She's strong-willed, and she went for it. And what happened next was absolutely amazing. What happened was fantastic. It just blew my mind. And she said adjusting the diet actually wasn't so tough at all. But she just wasn't a believer at that point. So it was a case for her of saying, okay, well, I'm going to give this a shot because there's some hope. 3 days into this, visible changes. After a week, confidence came back. And then after a month, which is what I said would be enough time to reverse it, it had almost completely gone. Acne almost completely gone. You could see that from a before and after picture. And she was ecstatic. She was pretty pissed off at a dermatologist for saying that diet doesn't have any effect on acne, but you can't really shoot the messenger in these things, because you look at the guidelines that we've just looked at on the NHS website, and it doesn't say anything about diet. In fact, it says it's a myth. So, look, it's not a big study by any means. We're talking about one person here, but the conclusion I came up with this, and I think this is the same as the other people, and the particular physicians that we looked at, and these clinical nutritionists, they're saying that the results occur with Gemma's skin so quickly because we address the causation of this disease rather than treating the symptoms. That's powerful. And the difference there is it gave Gemma control over the acne, not somebody else. And that's it. That means she doesn't have acne ever again. And that's really good, because a lot of people who suffer from acne, and they may get these treatments of drugs and so on, they can be left with scarring if it doesn't work. And that stays with people for life. And that's not good. And then also we can see, going into wider implications when we go back to this, we're looking at some of these types of diseases which when we go down the road are not very pleasant at all. People tend to not link these diseases and so on, and you wouldn't directly link them necessarily, but the same foods that promote the acne may promote these diseases as well. So that's what we're looking at. So it is amazing, and I think it's worth looking at this. So the case is amazing. A young girl's confidence being shattered by what is quite frankly a very visible disease. If not treated correctly, it will leave physical and emotional scars for life. I'm not saying we're going to get the same results with everybody, but this is provocative. And it's really, really empowering for the patient as well. I want this particular case study to serve as an example for young people that there is hope. And there is something to do about it. If you find this interesting, you've got any particular questions about the actual foods that Gemma was eating and she wasn't eating, then more than happy for you to get in touch, and we can talk about that as well. It may be different for different people, and we can look at that. And this was on the back of some blood work as well, so there was a little bit more to it. But the thing is, it proves that it works, and it's really, really good proof of concept. So if you like this, subscribe to the channel, ask me any questions you want. But I appreciate you watching. Thanks and cheers.